Hey everybody, this is Ivana from AL.com. This morning I was able to speak with White House Vaccinations Coordinator Dr. Bechara Choucair. We talked about the Delta variant that's rising in the United States, about Alabama's current vaccination rate, and about colleges and universities in getting those young people vaccinated. Here's that conversation. The Delta variants are becoming more popular in the southern states. Why is that? Why is this a southern state issue?
Well, we know that we're seeing increase in the Delta variant across the country and actually across the world, Ivana. We've detected now the Delta variant in 60 countries. And what we're learning is that that new variant appears to be more transmissible, appears to be associated with more severe disease, including hospitalization. So the good news, though, is that we know that a two-dose mRNA vaccine like the Pfizer and the Moderna, if you get both doses, those appear to be effective against this variant. So as we're seeing more and more of the variant around, it's another new reason to be able to get vaccinated.
You mentioned those two-dose vaccines that we know of, the Moderna vaccine and the Pfizer vaccine. What about the Johnson & Johnson vaccine?
Look, the Johnson & Johnson vaccine is an effective vaccine. It's a safe vaccine. It's appropriate for a lot of people. So we'd want to make sure that people are getting vaccinated at any time. All three vaccines that are available in the United States are effective, and we want to encourage people to get vaccinated. The fact remains, Ivana, if you're not vaccinated, you're still at risk, irrespective of your age, irrespective of your health conditions, you're still vulnerable. And for us to be able to put this pandemic behind us, we want to get as many people vaccinated as possible, particularly in the sprint to the 4th of July.
Now, I was looking at Alabama's numbers earlier today, and so far, Alabama has just under 3 million doses administered in the state, and there's over 4.4 million that have been delivered to the state. So there's definitely a discrepancy there in the doses that have been administered versus delivered. Is that an acceptable number for a state like Alabama?
Look, we want to make sure that we're working with state government, with local government, with health systems, with faith-based organizations, not-for-profit organizations, to make sure that we're making it as easy as possible for people to get vaccinated. It's great that we don't have a supply constraint issue anymore in this country, and we want to make sure that we're leveraging every dose that we have and try to get it into people's arms as fast as possible. That's why you're seeing things like extending hours at pharmacies on Fridays. That's why you're seeing us partnering to make sure that people can get free childcare. We're putting pop-up clinics at sports events. We're partnering with barbershops and beauty salons to make sure that these trusted folks are actually engaging with their customers to talk about the vaccine and maybe even offering the vaccine on site. So we'd want to do everything we can so we can take those doses that are already in the States and get them into people's arms as fast as we can.
There are quite a few major universities that call Alabama home. We've got the University of Alabama, UAB, Auburn University, and the list kind of goes on there. So we know that this Delta variant is especially prevalent among young people, and young people are also the people that we are worried are not getting vaccinated. So what would you say to those college-age people who maybe are coming to Alabama to attend university or college later on this fall, or who are already here and are getting ready to go back to campus? What would you say to them to encourage them to be vaccinated?
Look, I think for many people across the country, particularly the younger folks, they're saying, look, I've made it so well so far. Why do I need the vaccines? The numbers are already coming down. You know, do I really need to get the vaccine? And the answer is simply yes, you absolutely do need the vaccine, because until you're fully vaccinated, you're still at risk. And to your point, what we're seeing with the Delta variant out of the UK is significant transmissibility in 12 to 20 years old. So we'd want to make sure we're doing everything we can. And the only path, the most significant path to get us to be fully protected is to get vaccinated. So whether you're young, whether you're older, if you're eligible for the vaccine, and in this country means anybody who's 12 and up, please get vaccinated. It's never been easier to get vaccinated.
We know that one of the first universities that was announced to be part of this White House COVID vaccine challenge is actually in Birmingham. It's the University of Alabama at Birmingham. And they were actually hosting their first vaccine pop-up on campus this afternoon, just in a few hours from now. Do you want more college universities like the ones we have in Alabama to participate in that challenge?
Absolutely. I mean, here's like the name of the game now is all about the groundwork. It's about finding the right partners. It's about making it as easy as possible for people to get vaccinated. We're really excited about the university and the college's challenge. We have more than 300 that have already signed up to take on the challenge. And that's truly about putting in place systems and best practices to encouraging students to get vaccinated, staff to get vaccinated, and their communities to get vaccinated. So events like pop-up clinics at community colleges, extremely important, because we know, Ivana, that there's still millions of people who legitimately want to get vaccinated, and we need to make it as easy as possible for them to get vaccinated.
Our last 14 days in Alabama, our case rates are just a little bit under 2,000, excuse me. We've got 1,832 cases over the last 2 weeks. Is that doing well, or is that not doing as well as we want it to be?
Well, look, we're seeing steep declines in number of new cases, in hospitalizations and deaths, and that's great. And that's a testament that those vaccines work. I mean, just if you think about 65 plus in this country, there used to be 80+% of deaths in this country were people 65 years of age and older. Now that almost 85, or actually more than 85% of these folks have received at least one dose, we've seen 80% reduction in deaths, 70% reduction in hospitalizations. So we know vaccines work. We're seeing those steep declines across the country, which is great. But the fact remains, if you're fully vaccinated, you're protected. If you're not fully vaccinated, you're not protected. And we want to make sure that we're protecting as many people as possible, particularly as we're starting to see this rise in the Delta variant across the country.